Welcome to SCIN360 Advanced Anatomy and Physiology. Being that we have already studied the foundation of normal anatomy and physiology, what happens when the structure and function of our bodies goes awry? That leads us to the study of pathophysiology, which is defined as the abnormal functioning of diseased organs with application in medical procedures and patient care. Essentially, we are healthy when our bodies are in homeostatic balance, from the whole body level down to the cellular and to the atomic levels, and everything in between. When there is any disruption in the normal structure or function at any of these levels, we are said to be in a state of disease. The term etiology refers to the cause of a disease and consists of three main categories. If the disease is caused by a defect in the individual's DNA, the etiology is said to be genetic. Down syndrome is an example. If the defect occurs during intrauterine development, the etiology is considered congenital. Fetal alcohol syndrome is just one example. The majority of disease causation is acquired, and examples include diabetes, the common cold, and fractures. When the cause of the disease is unknown, it is deemed idiopathic. So what happens if we suspect disease of some sort? Typically, we seek some kind of medical assistance in which a healthcare professional will assess our symptoms, our subjective experiences such as pain and weakness, and he or she will check our signs or objective measurements such as blood pressure and temperature. The examiner may order additional tests such as CT scans and blood work and use all these findings to make an official diagnosis. So what is a diagnosis? A diagnosis is the identification of a patient's disease based on the analysis of the symptoms, signs, and findings from physical examination and additional testing. Once the diagnosis is made, therapy can proceed, which is the treatment of disease with the aim of achieving a cure, or at least reducing the patient's signs and symptoms to a level where some near normal function can be restored. Therapy can come in many forms depending on the diagnosis and can include oral medications, surgical intervention, or more holistic treatments such as massage or physical therapy. Based on all of these factors, a prognosis can be made, which is the prediction of the likelihood of recovery from disease. Typically, early detection and treatment of a disease leads to a good prognosis, whereas delayed detection and treatment typically result in a poor prognosis. Now that we have introduced these basic concepts, we will focus the rest of the semester on studying the pathophysiology of each of the body's organ systems in detail. To get started, review the course syllabus and lessons located in the menu bar to the left, and please reach out to your instructor should you have any questions over the next 8 weeks.
Created using Powtoon.